Hello and welcome back to everyone. I hope you all had a lovely break. I'm Margaret Brown and I'm the Depute Director of the Alzheimer Scotland Centre at the University of the West of Scotland. So my background is as a nurse, and I was a community mental health nurse in Lanarkshire for many, many years before I went to teaching and researching at the university. So I'm a Lanarkshire girl, and I'm delighted to be chairing this discussion today. Before we begin, I'd like to call in my colleagues. So before we begin and introduce ourselves, I want to remind you all that the Lanarkshire storytelling sessions to date have involved those who support people with dementia and unpaid carers themselves. Just a wee reminder, as they mentioned earlier, that these sessions are underway but are still ongoing, and so we are still collecting input. Once it's been done, the Lanarkshire local priorities will be updated to reflect what they tell us matters to them, and we'll share that widely. So moving on with our question and answer today, I want to, well, I'll get the people in the panel to introduce themselves. And so, Agnes, what about you? Could you tell us a little bit about yourself?
Hi everybody, my name's Agnes and I work for Take Control South Lanarkshire, which is a self-directed support service, and I am the coordinator there. I started there in 2014, which was when the Self-Directed Support Act came into place. On a personal level, I am an unpaid carer for my son. My son has complex needs, and he, including sort of autism, and he has learning disability, and he has uncontrolled epilepsy. Now, with epilepsy, he does have memory issues associated with that. So I can empathise with some of those issues with people living with dementia. And also I did care for my mother-in-law who had dementia, who sadly passed away. Self-directed support, it's something that is, what is it? People call it SDS a lot, though this is the sort of a term they talk about, SDS. And the simple way I suppose to explain it is that it's support that you direct yourself. There is 4 options to self-directed support, and in our job we will explain to people what those options are, and we can talk more about that when we're answering the questions and things as well. It's my personal experience that's led me to the job that I'm doing just now. My background is with carers, and I could talk about self-directed support all day. So I think if anybody does want to find out more information and more things about that, or more about, you know, what we've done, then please, you know, they can contact us. Thank you.
Lovely, Agnes. Thank you very much. What wide experience, so valuable. Thank you for being here. And Maria?
Hi there, hi folks. I'm Maria Williamson. I'm the manager of the Quality Assurance team based within North Lanarkshire's Health and Social Care Partnership. So my main involvement is about ensuring that we are commissioning and monitoring the kind of effectiveness of services across the partnership. I've been in post, my current post, for about 18 months. Prior to that, I was 20 odd years in the voluntary sector, so it's been a bit of a baptism of fire going back to public sector, I have to be honest. So really our involvement is working with our health colleagues and our social work colleagues and our commission services, just to make sure that we've kind of got a joined up approach, and actually we've got choice and quality services across North Lanarkshire.
Lovely, thank you, Maria. And Laura?
Hi there, my name's Laura and I work for North Lanarkshire Disability Forum. I've been with Disability Forum since 2019. I'm a community connector, so we run a couple of different services, but the service I take part in is for people who are not yet eligible for self-directed support, and we try and find them community supports, and obviously given the current restrictions, things that are online. On a personal level, I'm also an unpaid carer for my gran who has mixed dementia, so everything that's been said today is relatable. It's my life, so yeah.
Lovely, thanks very much, Laura. It's good to have you here too. And we've met the other 2 members of our panel, Helen and Annette. Do you want to just say a brief hello and add anything else you want to add at the moment before we begin?
Hello, yeah, I think you've probably heard more than enough from me as well anyway, and you know exactly who I am. Minister at St Andrews, and we offer a whole variety of different activities and support for people with dementia and their carers. Thanks.
Lovely. And Annette, do you want to say hello again?
Yes, hello again, and just a reminder of the role I'm playing here today. I'm a former unpaid carer. I live in West Lothian with my husband and children, and until recently I also cared for my father who lived in Lanarkshire.
Lovely, thank you so much. And not only have we these lovely women all smiling and ready to respond to questions, we've also got Anna Clements from Alzheimer Scotland and Louise Garner from the Haven, who are offline at the moment but are going to pop in to answer anything specific you would want to ask. And you can, as a reminder, you can put your questions in the question and answer box or the chat box. I wanted to start with something that came in just as everybody was speaking, which I think is really quite important that we let people know about. And Helen, particularly for you, people are asking if the Carluke Centre and processes and offers are available beyond Carluke to people within Lanarkshire.
Yes, simply they are. Yeah, we welcome anybody. We don't have any boundaries. Annette's been along and she doesn't live in Carluke. Folk are welcome. They travel from all round Clydesdale, and yeah, occasionally we've had folk even crossing from North Lanarkshire into South Lanarkshire. But at the end of the day, we're Lanarkshire, and if we're closer to folk and they would like to come, they're very welcome. Yeah, and I come from Shotts and she let me in too. It was fantastic, even from Shotts. And maybe Anna from Alzheimer Scotland, do you want to come in and say about your group as well?
Yep, so sorry if there's a little bit of a lag just now. I'm experiencing some technical difficulties today. So our groups are all obviously online at the moment, and we're hoping to open back up again when the restrictions lift a little bit further. We have a variation of groups. We are the group that you witnessed on the video today was a couple of gents from our carers call. They take place a Monday, Wednesday and a Friday. We also have quizzes that are running throughout the week as well, along with carer education sessions that we're offering. So as I say, everything is online at the moment. These were all previously face-to-face, but we have been able to access people that maybe weren't able to attend anymore. So it has given us a little bit of ability to support people within their own home, and I think it's been great to highlight that because it means it is something we'll continue once the groups open up. So if anyone would like any information about the groups, I'm more than happy to give that across, and we can send you an invite. Everyone is welcome.
Very good. You might be inundated, both of you ladies. I hope you appreciate that. So we're going to move on to the panel questions now, and we have some questions for all of you. First of all, this one is around communities and the groups and organisations within them, so that applies to all of you. And we know the huge role you play in supporting people with dementia and unpaid carers. Now, priority one, as we heard earlier, shines a light on this, but also highlights a gap in the connections, particularly with statutory services. So could the panel share any examples of work underway to address this gap that others might learn from? And you have heard of volunteering or being voluntold. So if you don't answer, you'll be picked upon. Right, Helen, go for it. Yeah, one of the things that we do at St Andrews is we work quite closely with the community mental health team for older people. And for us, that's really important. It's always been a really important part of what we do. And we have had a little bit of discussion about hopefully being able to work even more closely and perhaps being able to offer the post-diagnostic support groups when we can move back into the hall again, and offering them on the premises so that that perhaps removes some of the barrier from having to go in somewhere new that a lot of people find so challenging. And I get that. It's not easy to go in when you don't really know anybody and you're a bit scared and you've got other issues there too. But I think there is an issue with how we can connect sometimes, and partly because of data protection and sharing information, and statutory services operate in a completely different way obviously from what we do within the community and the voluntary services there. And I do understand the frustrations that carers have
because sometimes just now they seem to get sent round a circle between trying to find a GP, speaking to a GP, and being asked to go somewhere else. They go somewhere else and they send them back to the GP, and and there's this big circle that goes on in this hamster wheel. And sometimes our role is simply to try and support carers and to encourage them to keep on going with that. Because it is an issue, and it has been an issue as well during the pandemic, of people getting assessments done and all of these kind of things from statutory services. And I understand they're really busy too, but if people have to wait like 8 months to be able to even kind of get onto the system, by the time they get there, they're not only exhausted, but often, and sadly, the person has really, really deteriorated, because people with dementia their condition can deteriorate really quickly, and circumstances change. So they might start off with something that's not, it's not a huge need, a particularly pressing need, but by the time they get there, they really need a whole lot of support. So I don't know whether any other panellists want to share, their experiences in that as well.
I mean, it sounds as if there's real challenges, but I think there's also, what I love to hear there was that connection you had with statutory services as a human being, which is really what this is about too. Maria, you wanted to say something?
Yeah, it's just to say that Van Ale are one of our strategic partners, and we do fund quite a lot of services through the Community Solutions model, which is really about delivering services right in the heart of the community. And I think a couple of people have mentioned through sort of their presentations, obviously a lot of things have been sort of stepped back about or reshaped as a result of the pandemic. And as we're starting to get into recovery, us as a partnership, we're doing a lot of work about what these services look like and how we can step them back up. And they might be different going forward, because there'll be lots of learning for people around kind of the journeys that we've been. There's still anxieties around for people going back into sort of crowded places. But Van Ale are a strategic partner, and we commission a number of services through the Community Solutions model, and I think that's a really good way of kind of keeping our communities engaged. We've got a number of kind of engagement forums. We've just in the process of refreshing our 21 to 24 engagement participation strategy, which is really about getting people's voices heard and using them in terms of how we shape our services going forward to make sure that we're meeting the needs of people that live within our communities. And we also commission carers services. So Lanarkshire Carers will do our adult carer support plans, provide support and provide that voice for carers, and part of our carer strategy group as well. North Lanarkshire Carers Together are the kind of campaigning and kind of engagement around that. So there's lots of really good initiatives going on across the partnership, and what we're doing is looking at what the last year has been for us and how do we come out of that and how do we do that as a collective. So it
sounds as if there's a lot of work going on, Maria, and I think you're right. It's this, we're moving out a very strange period, and we already had lots of problems, and so it's these shining lights of people that are moving it forward that make such a difference, I think.
You're absolutely right. It's about being ambitious about it, and actually what was before might not be the way that it is going forward, but that might be right, so it's about just making sure that the people that are involved in that are connected and feel that their voices are being heard, and we're just at the start of that journey, I think.
Oh, I think you're right, Maria, and I'm just looking at the next question actually leads into this, because it talks about personalised support, which is taking us back to the person, from the services to the person, and maybe this is for you probably too, Maria, and maybe for Agnes. It asks about, can you talk about how current approaches to personalised support need to or can improve the experience for people in Lanarkshire, given what priorities say about voices not being heard and people having to tell their story over and over again. I'm sure you've all got experience of this. Could we maybe start with Agnes from your background too?
Yeah, that's absolutely fine. I was going to say, just with sort of based on the last question, we're actually funded by the Health and Social Care Partnership, so we have very strong links with the social work and also with health. So, as a voluntary organisation, I think people are more comfortable coming to us, but we do have very strong links with the partnership. We were asked to help them with the distribution of PPE for personal assistants. And also we're giving out lateral flow tests as well. So for people with self-directed support, there's a very specific area of support for people. It is very personal, and going on to when you're talking about the personalisation with things, what we would do with anyone that we're supporting, we would encourage them to plan. We would encourage them to have a person-centred plan, to think about what is important to them, because every one of us is different, everybody's needs are different, and everybody's support is different. So we would encourage people to pull together a plan of sorts, to let anybody who was working with them know exactly who they were, and we would be happy. There's lots of organisations out there who do the likes of that. For people with profound disabilities, PAMIS is a very good organisation, and they'll do a PAMIS passport. So if there was something like that that would be similar to someone with dementia, or looking for what's their interest, it's interesting to hear Carol talking about the stories that she has written, those kind of things. If there's something, what makes that person tick? This is the things that people need to find out, that information.
Yeah, I think you're so right, Agnes, about that one. And what, Maria, do you want to add a wee bit to that, about that notion of this idea of people having to keep telling their stories and how we make it more focused on the person?
Yeah, I know, and it is a kind of a thing that we hear often. We've just refreshed our framework for our self-directed support model, which will include our care at home, which is about sort of guided self-assessments indicating individual budgets for people. And there's a element of, we look at the family rather than just the individual. So there's an element of the kind of carers needs and taking into account of that. And it is really about what's individual to them, so that they're directing and sort of choosing the type of supports. It's the kind of element of choice and control for them around that. And I know that our carer centres are looking at some sort of toolkits around trying to support people, that their plan follows them rather than them having to refresh their story on and over again. So it's the parts of that that are relevant, that they choose to share and how they want to share it. So there's some really good work going on around that. But things of, I think probably things for everybody has been different over the last year. Lots of things been stepped down. So it's about just gathering pace with some of the initiatives that were kind of in process before we kind of went into our initial lockdown.
Yeah, trying to move, we're back to that kind of restart again, aren't we, really? Laura, this must be right at the heart of what you do.
It is. We in the community, the first question I'll ask when I go out to meet somebody, or laterally on the phone, it's what would you like? What can I do to make your life that bit better, easier, simpler? And like that, when I see a lot of people in the chat are talking about having to tell their story over and over again, and when we refer somebody on, I will share as much of that story as I can for that person, because it brings you down having to tell the same story to 6 or 7 different people over and over. So it is something that at the Disability Forum we try and share that as much as possible, just to make it easier.
Yeah. Thanks very much, Laura. I'm sure you do a grand job with that as well. I'm just thinking too, Annette, as a family carer, you must have many stories to tell about that one. And well, maybe just give us your thoughts on how, on the positive aspects, what could we be doing to make this better?
Yeah, well, from my point of view, every organisation that I spoke with, the information was definitely disjointed. So if I was speaking with my dad's GP, or CPN, or social worker, or his care provider, because my dad received care at home, he had a care package. Nobody had all of the information. Nobody had a complete package of what are my dad's needs, what's his story, but also for me, as you say, as the unpaid carer. Everyone had their own bit of information which was relevant to them and the role that they were providing, not the overall picture. Also for me, as a carer in West Lothian, caring for someone in South Lanarkshire, I didn't know where I belonged. Was it West Lothian? Was it South Lanarkshire? And a positive example is that at one of the St Andrews drop-in sessions, I spoke with a lady from the South Lanarkshire carers who told me about the carers of West Lothian. I wasn't even aware that the carers of West Lothian existed. And she proactively got in touch with the West Lothian carers on my behalf, and they got in touch with me. They were the ones who got in contact, and they arranged a day and a time for me to go in and have a chat and get registered as an unpaid carer. And I think that's a good example of cross-community and cross-regional support for an unpaid carer. And what I liked best about that example is that it was done proactively. I didn't have to take on another job of going out and seeking support. The support came to me.
Annette, thank you. That's really what we hear this morning all the way, isn't it, about that reaching out and stretching out for other people to give them help rather than waiting for that. I want to move on a wee bit, not very far away, but to self-directed support. There's a question about self-directed support, but I also see something in the chat about people who would like to receive self-directed support but live without family carers with dementia, which I think is, again, another layer of complexity. So the question is, why do so many people have difficulty accessing self-directed support? Is it lack of knowledge, or is it made more difficult? Maybe Agnes would like to start this argument and discussion off.
I think the difficulty is you don't know what you're looking for until you're in that situation. So I think, you know, the more knowledge that people can be given, then the better. So, you know, that's what we would do at Take Control South Lanarkshire. We would provide people with as much information as we can, with their rights and responsibilities if they want to become an employer or whatever it is that they want to do. We will take them, you know, we will take them from the start of the journey right through to the end. And if they want to, you know, if it's just different organisations or people that they can link in with, part of the funding that we had from the Support in the Right Direction was for a development worker. And that the development worker, very similar to the work that Laura does in North Lanarkshire, they have a mapping exercise. So we have a whole load with quite an extensive list of places which is people could link into, whether they wanted to visit or go. And I know it's very difficult just now because we are in, you know, we're in the situation we're in just now with COVID. But as we come through this recovery, and certainly with things being online, it makes it open to more people because we can cross those boundaries a lot better. I live in North Lanarkshire. I'm not far from you, actually, Margaret. I'm over beside television transmitters. So I live in North Lanarkshire, but I work in South Lanarkshire, so I can see the differences that are made. And sometimes even just the terminology that people use, I think sometimes even just that bit of a postcode lottery, depending on where you live, the different support that you have. I am hoping, I certainly live in hope, that with the talk of this National Care Service, that things may come in more in line and people will have a better service and it will be more uniformed throughout the country.
Great stuff. And Laura, you have a lot to do with this as well, I imagine.
Couldn't find the unmute button there, sorry. Yeah, we, again, part of our funding, especially part of mine, is again through the Support in the Right Direction. But like that, we're there to educate and support people through the self-directed support process. So if somebody comes to us and asks, do you know, I'm struggling, I would like to be assessed, how do I go about it? We can guide them through it. And we can be there for the whole journey. We can be there just at the start. It's obviously dependent on the person and the support that they need. A lot of the time it really is just about educating people through their options and just chatting through it, because it's complicated. Even now, I've been doing it for 2 years and there's still things that I need to go, wait a minute till I think about it, because it's complicated. So if you're doing that in your caring role and you're stressed, or you know you are coming having the effects of your dementia and you're struggling, then it is very hard going. But we are there if somebody needs that.
Yeah, it's you wonder how difficult this needs to be, and it is a complex process. So I suppose we do have to tease that out. I want to, I'm conscious of the time and I don't want anybody chasing us, but there is a question I think a lot of people would like answered is, Priority 4 talks about the impact for unpaid carers and how caring affects their sense of self and independence. As we move out of this pandemic period, what would be important? What would we take with us and would we build on as we move out of this pandemic period? And I suppose I would want to speak to a carer, and I know many of you are carers, but Annette's here particularly for that. Annette, what about you? What will we take out of this period of pandemic?
So before the pandemic, I found support from St Andrew's Church for both myself and my dad through the drop-in. And I could take my dad to the Friday afternoon drop-ins on occasion. Through the drop-in, my dad attended some outings, for example, a Christmas pantomime and a day trip to the Summerlee Museum of Scottish Industrial Life in Coatbridge. This support was hugely beneficial to me as well as my dad, because I knew he was happy, he was in familiar company. He was collected and dropped back off home, so I knew he was safe. And those were times when I could take off my carer's hat. There was a bit of a weight lifted and I could spend some guilt-free time for myself. Of course, when the pandemic hit, all of these kinds of support were withdrawn. I spent even more time with my dad, keeping him company, checking on his welfare, because he was even more isolated than before. So 2020 was really hard for carers and still is. As we move out of lockdown, I think carers are going to emerge quite battered, bruised and exhausted because of everything that we've gone through. Carers are going to need practical and emotional support to help them move forward with their loved ones living with dementia, because our loved ones have spent so long away from their old routines that it might not be as simple as just picking up again from where we left off. And as has already been said, it's likely that things are not going to look the same in the future as they previously were anyway. So the people living with dementia are going to need support from their carers and their communities to adjust. And I think that organisations in the community need to take a proactive approach in seeking out carers to offer this support, as I said previously, rather than the carers having to find that, because, as I said before, it's another job for a carer to have to do. Carers are going to need the support more than ever.
I think you're absolutely right, Annette, and just very briefly, I'm not going to say any more because I think you've said most of that, but for Helen, there is something about how organisations are now going to come out of the pandemic. There's been lots of digital support, but there's also been issues around digital poverty where people didn't have digital access, and all the people who haven't had that access over this period. Do you have anything, Helen, you want to add about what the organisations need to do in this next time and period?
Just really to back up what Annette said, exactly, we need to be there and be listening to people, to have that listening ear and that facility to listen and allow people to express what's happened. There needs to be space for that, and to be able to find different ways of doing that. And we're looking at having music sessions along with Acorn Music Shed, to be able to allow people to express the feelings that they've had of visiting through the window. That's been such an experience for people, and even digitally we look through square or rectangular windows at people these days. And also to provide some Heart for Art, to provide some art therapy. So we're looking at developing a Heart for Art, a carer space, and hopefully we get some funding to be able to do that. And we're going to start that hopefully fairly soon, just to provide emotional outlets for people. I think also, as Annette said, it's really important to try and get people back together whenever we can, and that might need to be initially outside in smaller groups, with whatever we can, because even just being outside is so important. Two carers just said to me last night from the short dementia friendly walk we've got on a Friday, we've only had a few people, we're just moving things gradually forward in line with restrictions, but that both both carers had then experienced the fact that their loved one spoke more, and that they said that they felt better, that their mood was a bit better. And it just highlights the importance of being able to be outside. And so, I think anything we can do about that, and just to provide a wee bit of support for carers and a listening ear, is going to be so important. And if to begin with that's outside, well, even if it's in this wonderful Scottish weather that we have, put on our raincoats and get the brollies out and do what we can really to help and support and give carers a bit of respite, because that's hugely needed now. Hugely needed.
Even we had snow and shorts last week, so in May. So yeah, we've got a lot to cope with. I'm going to draw this to a close. Much as I'd like to carry on for a long time. We've got more questions that we couldn't possibly get to, but I'm sure that we'll be able to answer over time. But I'd love to thank you for joining me, girls. Laura, Helen, Maria, Annette and Agnes, you've been fabulous. I also want to thank Louise and Anna, because I know they were standing by offline there for us in case there was anything. And there was, but we couldn't get to, girls. We'll get you after. I'd like to say goodbye and thank you. And I hope you have a really good day. It's been uplifting all day, and I think that's a good thing to take away with us. That was a great session. I so enjoyed it, and I hope you did too. And I hope you've got something from some of the responses from our panel. So next, I'm very happy to welcome a colleague and friend of mine, Arlene Crockett from the Life Changes Trust, who's going to talk about the Trust's Small Grants programme and a little bit about the next steps following today's event. Arlene, I'm going to hand over to you, and thank you so much for inviting me. It's been a wonderful day. I'm really feeling so good having heard all that wonderful work.